Andisika pamberi pemadzisekuru unoita zvinotaurwa nasekuru ndizvo. Saka sevarume ka topic yakuuya iyi. Are there any Ndebele speakers in the house? Manga kabakhuluma. Linjani madoda? Liqinile yini? Amaqolo aqinile. Awuzwa ke. Are there any vendor speakers? Awuri mzukuru wedu ke. Hapana kana one. Saka ndini na Josh Chet. Ndima cheloni abude. The house will say nda. Isusu atiombere kuchivenda ka tinozvivocalize. Saka pane vaya vanofunga kuti takauya kuHarare kuzotora mari nekuti nda. Tete titokuomberai mufunge. So I was saying kuti the next topic, I think it's going to get a lot of attention because tauda kupinda mu men's health. Ndizvo. Tamboudzwa nemutaura atanga kutaura nhasi kunzi unofanirwa kurara. Handiti? Kurara kwekuzorora. Then kune kumwe futi kurara. Udza ari paside pakuti unofanirwa kurara. Unofanirwa kurara. Pambeda. Kwete mumota. Kwete mubenzi. Kwete muBM. Anditi? So, gents, I want to introduce a speaker who is a medical doctor by profession, but a very affable gentleman, speaks the truth, talks and goes beyond the medical. He wants to talk to us about men's health issues, the wellness of being a man, critical. And we can't do anything if we're not well, including... And in men's health and those so allow me to introduce Dr. Hleza. Let's give him a big round of applause as he comes. That is noise kaya. Kamwe kacho.
All right, mukase. Well, my name is Dr. Charles Hleza, as indicated. I am a medical naturopathic doctor. I have got a medical specialty in lifestyle medicine, okay? And I also focus on mental health, that is depression, anxiety, and recovery management. I'm currently working at Balm of Hope Hospital, all right, as the lifestyle medicine consultant specialist. But I want to start by saying, knowledge is not power. Knowledge is power at its lowest level of appreciation. Did you hear that? But applied knowledge is power. Did you hear that? Yes. Applied knowledge is power. Okay, he wants me to repeat. Okay, so knowledge is not power. All right? Knowledge is power at its lowest level. But applied knowledge is power. Okay? So when it comes to men's health, most of us, we are concerned about MOF. All right? Is the flag standing? And as far as the flag is standing, it's standing for how long? Asisukasikere kuti ange pane gamba rafa too soon flag yapa half mast. Mababata era. Hanti kana gamba rikafa flag inoenda pa half mast. But we are expecting the flag kuti irambe yakadini iri kumsoro for long enough, but that's not happening. Now, when it comes to men's health, you want to appreciate that women live almost 5 to 7 years longer than men. All right? Number two, when it comes to suicidal tendencies, or suicidal cases, we have got around 27 per 100,000 of men committing suicide. And we have got 6 per 100,000 of women committing suicide. Okay? And we have got 6 out of 10 of men, that's 60%, who are having challenges of erectile dysfunction. Andisikutangira hangu apa ndikutangira panapa vanoti 1 2 3 4 5 6 7 8 9 10 pakati pe10 apapa 6 vacho flag iri kuremerwa kusimuka at some point zviri kubatika rezvo. Yeah, so having said this, you also want to appreciate that men have got several challenges that contribute to that. And I'm just going to share a little bit on that. Number one, men have got low health-seeking behaviors. Yes. Ukazoona murume aenda kuchipatara. Anenge amadendi. Yeah, so in the hospital facility, we have got men who come in when they are almost about to give up on life. They've been not feeling well for a long time. And we have got more men who will die after going to the hospital. And we have got women going out healthier than men. So when we are looking at men who are dying on average, we have got around 53% of men who are dying than women, when actually men contribute about 48% as far as the population is concerned. Are you seeing something? And we need to talk about this. Men, we need to man up. Then we have got what we call adherence. When we talk about adherence, wapiwa mshonga wako iwewe pa prescription. Adherence to prescription, when it comes to men, it's very low. Men default on prescription medication than women. Also, when it comes to time frame, yakuti wanonoka kuenda kuchipatara number 1, washika kuchipatara, wanyorerwa prescription, wakunonoka kunotora mshonga waya kupharmacy. Watora mshonga kupharmacy, pakutora mshonga ya manje, you are defaulting. So, rukutange kendo, rukuchwa kuzasi, nekumsoro. So ultimately, this then affects our bedroom experience. But I want to help you to understand this principle so that it actually becomes easier for you. So, ukaona uchenda ku toilet semunhurume. And pauri kuda kudiridza. Mvura haisi kurova madziro. Wobva utoziva kuti pane zviri kuitika. Mushina hausi kudini? Hausi kushanda zvakanaka. Ukaona uchimira mutoilet, handitati mvura haisi kurova kumadziro, iri kurovera panapa. Wakutobva bhutsu dzokuratidza kuti kunenge kwambonaya samwe but kusina kunaya. Wazvibata kazi? Wobva utoziva kuti hapana kumira musha. Zvabatika kaizvo. Then ukaona uchimira mutoilet, handi wazvibata kaizvo? Your stream, kana chirava stream tukona weti yako, urine yako, iri kutora nguva yakareba kuti ibude. Yazobuda, yotora nguva yakareba kuti ipere. Wayazopera, yapinda muhembe, wobva wanzonge watota mbichana. Wobva watoziva kuti hapana kumira zvakadini? Zvakanaka. So when it comes to these challenges, ukangona wakutanga kuita matambudziko iwawo, it's actually pointing to somewhere. Kuti unogona kuita dambudziko re hypertension or diabetes or arthritis. In actual essence, in most cases, obesity would have set in already. So you are probably in a pre-diabetic, pre-hypertensive state. Saka, that is the first pointer for a man to know. But it's a vicious cycle. Because iwewe pauchango tanga kuita dambudziko re hypertension kana diabetes richaenda futi kuno affecta your erection. So we want to talk about things that contribute to those particular challenges and how you can resolve them. zviri kubatika here izvi. Usati waenda kunopiswa neguchu, zviri kubatika here izvi. Because guchu rinogona kukupisa, zvabatika kaizvi. At the same time, usati wanyanyoenda kunotsvaga Viagra, because ukada kutsvaga Viagra at first usina kugadzirisa nzira dziri kufamba neropa, zvichareva kuti pamberi apo you are going to have more complications than what you are trying to resolve now. Zvabatika here izvi. Right. So number one, that's what we want to talk about. Inyaya ye-circulation yeropa. Circulation yeropa. Kuti mhofu amire, anongomira chete kana ropa rasvikako. Zviri kubatika here izvi. Pane chinhu chimwe chete chinogona kumira chisina mabhonzo. Zviri kubatika here izvi. Chinomira chisina mabhonzo, asi chinongomiswa neropa chete. Zviri kubatika here izvi. Saka ropa rinofanirwa kufamba rodzika roenda mhofu vosimba. Zviri kubatika here izvi. Kana mhofu vasimba vakuchiita basa. Zviri kubatika here izvi. Saka semunhurume ukangoona chete wakuita prosperity belly, wobva watoziva kuti pamberi apo zvichandimirira zvakashata. Zvabatika here izvi. Ukangoona wakuita kapoto kaunofamba wakatakura kwese kwaunoenda pamberi pedumbu rako, zvina kumira musha. Zviri kubatika here izvi. Tarisa munhu ari padhuze naye kuti turapoto. Right. So now, let's talk about this. So tiri kuti isusu ropa rinofanirwa kufamba roenda kuna mhofu ovadini ovhasimba. Saka zvichareva kuti pane zvinhu zvinoita kuti ropa risafambe richidzika kuenda kunani? Kuenda kuna mhofu. Dumbu redu iri rikatanga kukura richienda uku, rinotanga kutsikirira tsinga dziri kufamba neropa riri kuenda kunani? Kuna mhofu. Zvabatika here izvi. So the further it goes, the more it's reducing blood flow. Kunani? Kuna mhofu. Mazvibata guys. Saka dambudziko harisi rekushaya Viagra kana guchu. Dambudziko harisi remudzimai ari kutadza kuperforma. Zviri kubatika here izvi. Dambudziko nderekuti mhofu havasi kuwana ropa rakakwana. Zvabatika here izvi. Zviri kubatika here izvi. Saka iwewe pauri kunotenga Viagra kana kutenga guchu, uri kutraya kuunza ropa rakawanda kunani? Kuna mhofu. Kwenguva yakareba, but mapaipi ari kufamba neropa manje adzvanyidzirwa. Zvabatika here izvi. Saka nhasi uchamwa 1. Mangwana 1 harichashandi, wakuda 2. For those of you that have used it, you can confirm. Kuti ka 100 mils akachashandi, kwakudiwa 200. Zviri kubatika here izvi. Simply because nzira dziri kufamba hadzina kumira zvakadini? Zvakanaka. So apa ndichambotsika madomasi apa. Tsika madomasi kuti tsatisa chaiko madomasi. You want to appreciate this. We have got what we call cholesterol kuchirungu. Mazvibara guys. Saka cholesterol mafuta atinogona kuti lipids kuchirungu anoyerera muropa. Muri zvibara here izvi. Saka paanoyerera muropa mafuta aya anoita kuti ropa riteka kukora so. Saka na ropa rakora manje harichanyatsofamba mafambiro arinofanira kunge richiita. Zviri kubatika here izvi. So we have got a pump that's supposed to pump. Zviri kubatika here izvi. Pump inofanira kusunda ropa rine a certain consistency. So your prostate is like a pump. Inenge ichisunda semen nezvimwe zvichifanira kubuda uchinjoya uchinakidzwa ndizvo nai. But ropa rikakora manje inoremerwa. Zvafanana nepump inofanira kupamba a certain consistency of water. That's what it's designed for. Kwete kusunda mvura yasangana namafuta. Zvabatika here izvi. Then number 2, we have got what we call saturated fats. 2 types of fats. Zviri kubatika here izvi. Masaturated fats anosvika onoungana mukati metsinga dziri kufamba neropa. Zviri kubatika here izvi. Tsinga dziri kufamba neropa otanga kuungana mukati. Ndimbobvunza mubvunzo. Kana ndine pipe yangu ine diameter ye maybe 5 millimeters. Zviri kubatika here izvi. And ndine pressure ndinoda kumaintaina pandinoda kudiridza handitika. Mukatanga kuaccumulata tsvina mukati kana madhaka mukati what's going to happen to the pump and what's going to happen to the flow? The pump is going to overwork, inogona kutotsva, the flow is going to become less. Yeah, so you got it right. So we have got 2 food articles that as men we need to be worried about. Inokonzera kuti pump iremerwe, yokonzera kuti flow idzike. But in our mindset, tinofunga kuti that food article contributes kuti ropa rifambe zvakanaka. Zvirikubatika. And what is this? Inyama. Meat. Zvirikubatika. That's the greatest source for cholesterol, the greatest source for what? For saturated fat. Guys. Number 2, tine mazai. Mazai mainly are rich in what? In cholesterol. So World Health Organization will recommend that an adult should eat 1 egg in 3 days. Guys. Yeah. Saka zvakureva kuti pari kurova 1 egg in 3 days, flag yako yacharamba yakadini? Yakamira, and for a longer period of time. Zvabatika here. When it comes now to consumption of meat, you want to appreciate that red meat is classified as a carcinogenic element, cancer-causing element. Yeah, so you are better off in white meat and other meats that are not red. But as far as consumption is concerned, we recommend around 80 grams per sitting. So your 80 grams is almost like a deck of cards. A deck of cards, that's about 80 grams of a portion of meat. And not more than 350 grams per week. What is this going to do? Zvichaita kuti ropa rako rimhanye zvakanaka. Zvoita kuti prostate yako isazotange kukura to try to compensate for low pressure. Zvirubatika ndio ata kuti prostate hypertrophy. So you want to ask yourself a question as I'm concluding on this particular one, on saturated fat and cholesterol. Kareko varume vangani vainetsikana nekumisa flag yavo? In comparison to now, if we are going to say, in your community where you stay, toti dzimba idzi dziri 10 years ago, apa tinotengesa mazai, uko tinotengesa fish. Iye zvino apa pane mazai, pane fish, pane broiler, apa pane mazai, pane fish, pane mbudzi. So you see, where we are, our rate of consumption of animal products is skyrocketed. And at the same time, erectile dysfunction is doing the same. At the same time, prostate hypertrophy is doing the same. At the same time, prostate cancers are doing the same. Correspondingly. So now you've got a solution. Then number 2, when it comes to men's health, inyaya imanje nderimwe domasiri. You want to appreciate that munhu akasikwa naMwari. When you read from the book of Proverbs, you know, a prudent man foreseeth danger and hides himself. Saka watuona danger, and you are supposed to know what to do. But a simpleton, what does he do? He proceedeth and then he gets punished. Now, what I want to talk about now, inyaya dzepabonde. Tataura nyaya yekuti flag ichamira. Ndizvo nai, number 1. I've just given you just one tip yokuti flag inogana kubatsirwa sei kuti imire. Guys. And you can actually get people around the world pana anonzi blue zone. Blue zones, those are areas where people live into old age. Muruzvibada vachisvika kuma 90, asvika kuma 100, mufu achimira. Muruzvibada mufu achimira, mufu akamira, mudzimai achidaidzira kuti yes shewe magona. Zvirikubatika. But some of us, we are actually half a centurion. Asati asvika, tiri pa 50 years. Umwe ane 100, akamira flag yakadini, yakasimuka. Iwe yako yakutoneta uri pa 50. Mashibari guys. Yakutobatsirwa. Now, the second thing I want to talk about inyaya ye ejaculation. I know you've been to other programs where you learned some things about ejaculation, but I just want to give you a tip, okay? When it comes to ejaculation, we only have got a minimum recommendation, not a maximum recommendation. So everybody get it? And I'll tell you the reason why. The minimum recommendation per month is about 8 times, which is like 2 times per week. Is that making sense to you? I want to tell you why it's like that. Forget about 21 times. Minimum of 8 times per month, which is twice a week. So every time when a man engages himself, he loses virtue number 1. So everybody get it? Vital force, Buddha, number 1. Number 2, there are some nutrients that are also lost, of particular importance: zinc, magnesium, and selenium. On average, that should be recommended data allowance can range between when you lose maybe 1 milligram to about 5 milligrams, but per day, the recommended is about 11 milligrams of consumption. But most of us as men, we are so much concerned about so many times a month. And it Tarasa. Tara, and a day, not a month. Tarasa, this one that which replenishes in our diet is lacking. So therefore, we then increase the risk of what I've mentioned: erectile dysfunction, prostate hypertrophy, prostate cancers, and other related main issues. So I want someone to just comment on this one, who is probably knowledgeable. When we were growing up, vanambuya kuti vanasekuru vaitikangira chii chekunofudza nacho mombe. All right, let me try him.
Kwa kune maputi ai crash wa inzi mbwire.
All right, I'm looking for another one. Another one.
Nzungu.
All right, and Nzungu. I'm looking for something else. I'm looking for something, yes. Right, he got it. Modzi Zemananga. Are you getting it? Why? They are rich in zinc. And most of our diets are deficient in seeds and nuts. And I want you to understand this. Your brain needs zinc. Are you picking it now? Huh? Right. So for your brain to function well, it needs zinc, it needs selenium, and it needs magnesium. You are not so much concerned about those. So now, as far as your mind is concerned, wakuitanga uri inferior in your thinking capacity. But it's because we are not taking care of that particular machine that you are supposed to use to be able to be a man that is present than a man that is absent. Absent in bedroom, kubasa uri absent, my key performance indicators are low. In the community, you are absent. For your children, you can't even help them with a project. You know, yes, himself. You can't help them. So a man is failing in the bedroom, he is failing kubasa, he is failing in the community, he is failing his children. Because of misconceptions of what to eat. Guys. Now, let's move away from that one. Let's talk about exercise. Exercise for men is very, very important. Guys. Ivamurume anosimudza usimbi kana wachikwanisa, anomhanya kana wachikwanisa, anofamba kana wachikwanisa, simply because it improves circulation of what? Of blood. Guys. Besides improving circulation of blood, it also helps with what we call feel-good hormones, guys, which are endorphins. That's one group of them. When you are feeling good, you think better, you perform better. If you are feeling good, even at home, even in your workplace, you are going to have better performance. So as a man, you should have an exercise plan, an exercise program. Usakurirwe nemadzimai vari kuenda kunana coach chakati vachinojamba vachidzika iwewe hausi kujamba uchidzika unopfuka unojamba naye ero unosarazve zvinobatika guys. Saka as men we should have a what? An exercise plan. Zvinobatika guys. Now let's talk about sleep. When it comes to sleep, I know there is a notion that we learned at school sometimes, which is a misconception. Kuti unofanira kunyika makumbo muchi mubhaketi rine mvura inotonhora woverenga kuti upasi. So then we get into the work environment, into adulthood. Tiri kufunga kuti isusu kuti ndinzi ndazobudirira muupenyu ndofanirwa kuve ndiri murume asingarari anoshanda neusiku. Zvirubatika rese. And that becomes a habit. I'm not talking of working at night once in a while or once a week or something like that, or maybe 1 week out of 4 weeks. I'm talking as a habit. And some of us, when it comes to sleep, tovatatora substances that are rich in caffeine, the boo, the switch. Guys, to stay what? Awake. So you are awake, but as far as alertness is concerned, you are not there. If you have ever been to Mutare, we have got, the Christmas pass. Yeah. Imagine you are going to Mutare. You are a passenger. You have got a driver who's driving. And you check the speedometer, you see he's doing 100. Going down Christmas pass. And then he takes a glance at you and says, Chamar, and this is not a break. And this is not a break. Right. Now, so that's what caffeine does. That's what the boo, the switch does. When the body is saying, I have had enough, plug me into the wall, like what you do with a cell phone, and recharge me, caffeine comes and blocks those sensors and says, let's keep on going. Let's keep on going. So by the time you reach your destination, you think you have achieved, but you are actually in negative returns. Yeah. So if there is anything men wants to do is to sleep 7 to 8 hours per night. It improves your intellect. It improves your mood. It improves your intelligence quotients. But of course, there are times when you may miss 7 to 8 hours. It's okay, but that's the recommendation. So we have got 2 hormones when you are sleeping at night that are at work. One is called ghrelin, the other one is called leptin. Of these 2 hormones, one inoti iyo unenzara idya kana wamuka. Mashobara guys, unenzara chi idya. Imwe yacho yobva yati zvawadya waguta chimira kudya. Ucharamba uchinzwa kuti hausi kuda chikafu for the next 4 to 5 hours. When you sleep less than 7 hours minimum per night, those 2 hormones flip. The one that says unenzara idya, and namba uchiti unenzara chi idya. Iri kufanira kuti wadya zvakwana, you are going to be satisfied for the next 4 hours. Ine namba uchiti hausati zvakwana, you are not satisfied. Mashobara guys. So what's the effect? You overeat. What's the effect? Overweight. What's the effect? Unobva watanga kuva nema challenges hypertension, diabetes, which then affects erectile function. Mashobara guys. So in as much as you are trying to spend much of the hours in the night making money, I want to tell you this. This one gentleman, one of the richest gentlemen in the world who passed away. When he was in his bed suffering of cancer, he said, all the money that I had made in the world could not come and sleep in the hospital bed on my behalf. I had to be in the hospital bed. Did you hear that? So in as much as you're trying to be a successful present man, providing for your family, providing for the community, providing for your wife, you need to take care of yourself. Shurubadi garez. Yes. So one of the insurance companies around has got a beautiful insurance policy that I can recommend to you, whereby if you contribute to it when you die at a certain stage, even after 3 months of starting that policy and it has matured, you can actually leave a legacy for your children, leave a legacy for your wife if you want to. You know, one thing they said to me back those years when I was taking that policy, they said to me, and this was a wake-up call, when you are aggregating your insurance, who is going to benefit from the lifetime, consider your children first. Your wife can get married again. And consider your what? Your children first. Because your wife, after you die, can get what? Married again. But vana vako iwewe ndo vane modzi yedzinza rako. So I think lastly, I want to talk about what we call phytochemicals and antioxidants. All right? Phytochemicals and antioxidants. Phyto means plant. Chemical, mishonga. Satukira mishonga inowanikwa muma plants. Mashobara guys. So I want you to close your eyes, all of you. Musabirire. Ati mvare maziso. Dakuti mufunge an apple and the color is pink. And I want you to bite it. And I want you to chew it. And then I want you to swallow it and open your eyes. So what you saw was a pink apple. When you bite it, it was a bit hard. It was not as soft as a banana. When you bite it, the inside was white. It was not pink. Somebody get it? And when you swallowed it, it had a taste that is sweet as opposed to an lemon. Guys, all those properties have got healing virtues. And it's my antioxidants. Oxidation is the process of rusting. My body and your body, they rust. That then, which acts like a paint or aluminum coating on this particular metal gate, which is your body and my body, it's plant foods. And we are talking of the color, the smell, the scent, the texture. All those have got what? Healing properties. So the less fruits, the less vegetables you take as far as your diet is concerned, the less whole grains you take, zvirukureva kuti gedhi rako uri kushandisa paint yekumagaba instead of using maybe Dulux. What that means to you is to reduce degeneration or rusting as far as your body is concerned. You want to make sure that on a daily basis, when you are sitting down to eat, there is either fruit or vegetables, and there is whole grain. And of course, you want to have water, more water than alcohol. Because water is the one that helps to take away the metabolic waste from your body. We can talk some other time, but I want to thank you for the time you've given me as we talk about men's health.
Let's just do it like we mean it. Chibaba chakaipa ichi. tarisa mufesi ari panext newe, ingomutarisa so. Anti hanzi iwewe ukafa, mukadzi wako anoroorwa. Mufesi yeye wawakatarisa iye anogona kukubvutira.